Mike's email back was just that. I think it is two individuals who are saying, look, we know we've got a deadline to meet and we're ready to do it, and here are some of the things that I'm concerned about, but will we make that deadline? A lot of people are saying, at least comments that I have heard is that, well, did you rush it, did you not? We have 24 people now that have health insurance that didn't have health insurance before. Some people might say, well, and they might ask, did you rush it? Those individuals will tell you that you didn't make it happen fast enough. You know the number of calls that we've had in. They are extraordinary. It cannot happen overnight. Insurance begins on the 1st of every month. When we started to get, I'm going to guess, I'd have to go back and look at the actual numbers, but if you have between 7,000 and 8,000 phone calls, we didn't have that many applications that actually went out on the 1st or the 1st of July, but the applications, they have to go through them. They have to determine whether they have health insurance now. If in some cases, whether or not they qualify, they don't want to be without health insurance for 6 months. And so we really did have 24 that have actually signed up or been eligible and been accepted. The health insurance begins on the 1st of each month. The next wave will take effect on September 1st. We have all of that time in there to bring hospitals on, and the doctors come with those hospitals, and we continue to sign them up.
But the commissioner did say in that email, the last thing you'd want to do is to start the program without a network under contract.
The network was underway, and we really don't have a choice on when we start it. When the law says it will begin on July 1st, it begins on July 1st. Let me just share with you, and I know you didn't ask, but I figured you would today. Because I think it's important. I have a stack of emails from constituents and people who've called our office and said, let me just read one that came in on July 24th. There are no words to thank you enough for providing the new Charter Oak Health Care Program. I'll go through the rest of it. The person was at the end of their rope, and a miracle happened. I am actually crying with happiness and relief that this happened. Thank you in the legislature for providing this much-needed program to all of us. I am so grateful. Thank you a million times over. This is the kind of stuff that we get day in and day out. These are people who are saying there is a definite need out there. Thank you for making it happen. She may be one of 24, but she is one person who has health insurance now that didn't have it before.
So what kind of coverage is it?